Hello, my name is Evan Joyce, United Nations Resident Coordinator's Office to Malawi, Community Engagement Field Coordinator.
Hello, my name is Fresco Masuku, the Senior Disease Control and Surveillance Assistant, Liganga Health Center, Mwambo, Zomba, Malawi.
And we are going to show you in this video how to prepare a coronavirus community care map. First thing is draw a big black square. Each square on this map is going to represent a household. So, how many people live in your household, Fresco?
4.
4. There's 4 in your household, then you put 4
Yes.
in this inside.
Box ili likutanthauza nyumba ngati ne nyumba mwanga mumakando 4.
Then out of the top corner of that box, you do another little red box. How many vulnerable people live in your household, Fresco?
1.
There's 1 older person in your household, then we put a 1 in there.
Actually, a pregnant woman.
Oh, congratulations.
Yes.
Out of the bottom right corner, do a little green box. This is going to be for how many community volunteers live in your house, Fresco?
2.
2. And a little blue box down here on the other corner. How many people could you host, Fresco, if coronavirus hit your neighbors and maybe you had to take in an elderly person from another household?
1.
1. Okay. What you're asking the community to do is to do this for every single household in their community. But they're going to make sure that their communities, their households are much smaller than what we just drew. And it's a good idea to tell them to start with the borehole, the jigo, in the center of the community and work outwards. What are we asking these volunteers to do?
So here are 5 households, and there's somebody in the top household is starting to cough, and they think they have coronavirus. So straight away the volunteer from that house goes to the chief's house, who's sitting in the big white chair, and they inform the chief. The chief gives them a hand washing bucket that's going to be placed just outside the household of the sick person, so that anybody going into or out of that house, they're asking now who can volunteer to take in the other old person who's living in that house to protect them from getting infected. And that's been taken in by the household at the bottom. There, the sick person and their volunteer are shouting for water, so another volunteer from a different household has gone to the well and is quickly delivering water. And after they deliver the water, they wash their hands before they leave that household. Oh, and now the sick person is saying that they're hungry. So another volunteer is going to the maize mill to get some maize meal. And there's a delivery of food to the sick household by another coronavirus community care volunteer, who is afterwards washing their hands before they leave that house. Oh, there's a shout for Nkuni, firewood. There's another volunteer standing up to go and get firewood. That is quickly delivered to just outside the house without going into it, and then that coronavirus community care volunteer has washed their hands before leaving. And that gives the volunteer who lives in that house all they need: firewood, water and food to care for the sick person who has coronavirus without leaving the household, and so without spreading coronavirus through the rest of the community. And as you can see, everybody here is wearing a mask when they are out and about between households, and the carer is wearing a mask all of the time when they are in the household.
Add up all of the total number of people in the household, you get the total population of the community, the total number of vulnerable people, the total number of volunteers, the total number of quarantine rooms or host beds, and the total number of houses. If a household needs to go into isolation, can there be volunteers in the community who can safely deliver water, deliver food, do trips to the maize mill, deliver firewood? We found that very consistently across the 100 communities where we did these maps, that there are more volunteers than vulnerable people. So number 1 on the list of things to do for homework: complete the community care map, but don't just have the chief and the borehole committee members make up the numbers of how many volunteers and vulnerable. People need to go around, especially to seriously recruit the volunteers. Remind people another part of the homework is to gather questions, the community's questions about coronavirus. There will be new questions between your first meeting and your second meeting as people think about things more. If you have the resources to bring soap and masks to this meeting, suggest to the community. One thing that worked very well for us was to give to the borehole committee members the soap and the masks. Tell them to use some to make sure there's always soap at the borehole and at the hand washing bucket for the borehole, but also to sell them as a pair, 1 mask, 1 soap, 100 kwacha. Let the community use that money generated from the sale of masks and soap to help support households that go in isolation. The main message here is protect the vulnerable.
Uthenga waukulu kwambiri apapa ndi pamene akunena kuti tetezani okalamba. Sono kankani mene zikomo kwambiri.
Zikomo kwambiri.